Hi, I'm Danny Glover. When a person is suffering a stroke, it cannot be emphasized strongly enough that time is brain, meaning the sooner someone receives emergency medical attention, the greater the chance of a significant recovery. Let's look at how IR techniques play a major role in urgent stroke therapy.
A stroke occurs. So what happens next? After calling 911 and being transported to a hospital's ER, an individual who has suffered a stroke receives a rapid clinical evaluation from ER doctors and probably also a neurologist. This process typically involves computerized imaging of the brain, known as a CT scan. If the CT scan reveals that there has been no brain hemorrhage and the symptoms of stroke have been present for less than 3 hours, a clot-busting drug known as tissue plasminogen activator, or TPA, may be administered by vein in order to eliminate the blood clot that is causing the stroke. Approximately 30% of stroke patients will experience a good outcome after receiving TPA. However, if an individual shows no neurological improvement by 1 hour after the administration of TPA, or if the immediate use of TPA isn't possible, the patient may then be a candidate for a procedure known as endovascular clot removal, or thrombectomy. 2 FDA-approved devices are used during this procedure through a groin puncture, typically performed by a neurointerventional surgeon. These devices are intended to drag an offending blood clot from a brain artery.
The device is deployed by first passing a small microcatheter from the neck up into the brain artery that is affected and through the blood clot, blocking blood flow. There, the stent device is deployed through this small tube or microcatheter. It immediately starts the restoration of blood flow to the affected part of the brain. And then, after several minutes of waiting, the blood clot becomes incorporated into the stent and it is pulled out from the blood vessel.
The next day I came to, and my son was there. And then a little while later, my daughter and my granddaughter, and it's just terrific. I had no strength on my right side, none whatever. And then slowly I began to walk, to talk, to do all kinds of things that I hadn't been able to do.
Endovascular clot retrieval needs to be initiated within 8 hours after the onset of stroke symptoms. However, the sooner it is performed, the better the chances for a positive outcome. This 35-year-old female had just delivered her second child 6 days before a blood clot migrated from her heart to nearly completely block her right brain circulation, shown on this brain CT angiogram, causing immediate left-sided paralysis and decreased consciousness. Blockage of the right brain arteries was confirmed on a cerebral angiogram. However, just 5 minutes after deploying a stent retriever device within the arterial blockage, the offending blood clot was pulled from the brain, restoring near-normal cerebral blood flow. Remarkably, 3 months later, she returned to work and was again driving and jogging.
I'm grateful that there are technologies that are so important for people like me.
All of these devices are intended to restore normal brain blood flow and place the patient on the path to a recovery. And remember to recognize and respond to a stroke fast. F, facial droop. A, arm weakness. S, speech difficulty. If you experience any of these signs or recognize them in someone else, then T, it's time to call 911 immediately.